Uh, Good morning, everyone. Welcome, and I'm so glad to have each one of you join us today. Um, so we'll get going. This recording will be available for later. I'll pass it on to all of you all. So today we have with us Dr. Dipti. Dr. Dipti is a physiotherapist by profession, but she's got a lot of experience. And I want to just introduce you. It will just take me a couple of minutes to introduce you to her because she's got quite a lot of things which is going to help us, quite a lot of experience which is going to help us to understand this topic of autism and neurodiverse children. So Dr. Dipti is she's qualified as a physiotherapist. She's a master's in physiotherapy, but she's also an assistant lecturer in the International Aquatic Therapy faculty from Switzerland. She's an aquatic therapist certified. She's a certified aquatic therapist from Switzerland. She specializes in water and water specific therapy, certified in general movement assessment, and she neurodiverse therapy is what she does. So, and she is also done therapy in SCROT, I mean, certified in CROT method of spinal care, kinesiotaping therapist. So she's got a lot. And she's also the director of Arosh Aquatic Therapy. That's the name of her clinic. And recently, she's joined our team at Ashok and Ashok Hospital in Daisar East. So she is part of our team, and I'm so glad that she's agreed to come today and talk a little bit on autism spectrum disorders and ADHD, and how her field and her specialty helps such kind of children. So I'd like to welcome Dr. Dipti and welcome each one of you all, for being part of this webinar. So Dr. Dipti, you want to say a few words before I jump in and ask you questions?
Yeah. Thank you, Dr. Vinita, for getting me into this platform. As in, this is a very close to my heart, and I just want to share a little background about me. I'm into this pediatric physiotherapy field because I have a nephew who is a cerebral palsy adult now. So when I was in a 12th grade, he was diagnosed as a cerebral palsy. So that was one thing. Anyway, I wanted to become a doctor since my childhood. So yeah, and then it went into in a position that I became a physiotherapist. So there are a lot of fields in physiotherapy, but I chosen pediatric just because of him. And being having a neurodiverse child in the house, he's my nephew, is my bua's daughter's son, yeah, that way. So my sister used to face lot many challenges, and this is like around 2022 years back. Yeah. So I understood that. And when I was into this, I've graduated in physiotherapy, and then I did my some specialization, which is like neurodevelopmental technique. This is basically done for the neurodiverse children, which is a which is a USA certification. And then when I was doing these techniques, I always felt that there is something is a lacking while treating these children, which comes the sensory behavior and the sensory system of the children. So that was one thing I was always into this process, that how everything I can all kind of things where a neurobiology or anatomy, physiology, how it gets into to get the complete feedback or complete kind of a diet to the child where he would be more functional. And my nephew was already having kind of we called these traits of the spectrum. So it was,
Okay.
so initially everybody used to call the mentally retarded child. So now nobody calls that way. It's other differently able children. Those are different
Yes.
people. So my nephew always used to have those kind of a traits. So we always used to wonder why he keeps moving his head, why he keeps doing that, why he keeps putting his hand in the mouth. Okay, so those things were really for the concern when I became a physiotherapist also. So sensory integration is the one who really helped him to reduce these symptoms and make his body more regulated. And when I did all these things, so there is a different kind of a complete population, which is autism spectrum, ADHD, and a learning disability population. So this sensory integration really is helping all these kind of children. So that was one thing I wanted to share. Yeah, now we can begin with our questions.
Yes, yes. Thank you so much, Dr. Dipti. So
Uh,
basically, is my internet okay? Yeah. Am I audible?
now it's
Yeah,
fine.
yeah, yeah, yeah. So basically, wanted to, I mean, you already described what is neurodevelopment technique and the sensory integration. So I feel that we have already done two sessions. One is with the pediatric psychiatrist, and we did one with the psychologist who also both of them had somebody in their family who was struggling with this. And you also mentioned, and I know that you do a lot with regards to aquatic therapy. So how does all these kind of things fit in together, and how does it help children having these kind of disorders like the autism spectrum disorder and ADHD? So can you just tell me how all your experience helps such children?
Yeah, so anyone, if any child with ASD or ADHD walks into the any clinic, everybody tells them or guide them for okay, आप लोगों को occupational therapy करना है, speech therapy करना है, remedial education करना है, ये सब चीजों का list हो जाता है उनके पास. Psychological जो आपको developmental pediatrician के पास जाना है, and then there are some people who really visit our center. So though we have all these facility, we have a complete multisensory integration gym, what we can say, all the equipments are available in the clinic. So when I talk about how the physiotherapy also helps into it, so physiotherapy will help them to develop their complete postural control. Okay, postural control, it will help them to have a structured movement. So if I'm reaching for the glass of what glass of the water bottle, okay, so why and how my movement would be coordinated to hold that water bottle and then take it into the mouth. So this is a physiotherapist's job to maintain the posture, coordination, movement. Okay, so that's how that always complement the occupational therapy. If my child is sitting like this, he will not be looking at the glass or the water bottle. How I'm supposed to reach? Where the glass is kept also on the table. So the physiotherapy will help him to control the posture, to reach for the bottle, and help him that function. And then the fine motor activities, like how the grip would be strengthened to hold the glass of water, that is the occupational therapy job. Okay, coordination, hand and eye coordination, unless and until your posture is not correct, we will not be having a good eye hand coordination for any activity. So that's a physiotherapist job. Okay, and then when I come to the aquatic therapy, yeah, so aquatic therapy is the blessings for all the kids with ASD, ADHD. So let me give an example. If any child go to the pool area, okay, any swimming pool, any resorts or anything, what they will just keep look at that vision, look at that the big body of water. Oh wow, this is so soothing. So the water itself gives that the soothing feeling, and there only they stop. So if child does not have the eye contact, okay, but if they just look at that the water body, they try to look at it. So how this will be? So this is again the vision. I'm just going to give the sensory system involvement into it, how it would be related to the disease, or the disorder. Fine. So vision is the one always get एकदम से देखते रहता है वो बच्चा पानी की तरफ. Oh, this is so good, can I go and touch the water? जैसे बच्चा आ जाता है थोड़ा पानी में, the पानी में splash करने लगा, और maybe just he enter in the water, your tactile system gets अरे कुछ तो भी pressure आया मेरे पैर में, या मैंने हाथ लगाया, मैंने ये किया, oh I'm feeling good when I do this movement. Okay, so and once you start walking or little bit jumping in the water, your proprioceptive system gets activated. When we start running or maybe just walking or moving, अरे किसने मुझे हाथ लगाया, क्या देखा, या मैं टॉय लेने के लिए जा रहा हूँ, your vestibular system gets activated immediately. And अगर पानी के आजू बाजू में भी हम जाते हैं, so there are people, auditory system, वहाँ पे jet sprays है अगर पानी में, so अरे ये आवाज कहाँ से आ रहा है, he'll go and touch over there. So all the sensory system integration happens in the water, and they feel it's a best environment, because if they are running in the pool, they are jumping in the pool, my job is done, because I am activating their systems just with the play activity. So it's not that I will just keep them running in the pool or just give the jumping, then I will be having my structured format of therapy. So that there
Okay.
it comes the water specific therapy. Hmm?
Okay.
So if my child does not have a eye contact, so Miss Sheetal has already explained about the symptoms in the earlier videos. Eye
Hmm.
contact है, ग्रिप है, नहीं देखना है किस चीज के बारे में, मेरे ये this stimming behavior is always there, I'll just keep moving my head, I'll just clapping my, so if the clapping is there, I'll ask him to just clap in the water. Hmm? I,
Hmm.
I get more proprioception, and ये ऐसे ऐसे नहीं होता, then it happens like this, which is good to have their whole body system awareness.
Okay.
Okay, and they are completely immersed in water, it's complete that they start feeling their body. So why do you feel that the children with autism are completely like this running? Because they do not have their body awareness.
Okay.
They do not understand whom they are, they do not understand who is the person in front of them, whether it's a mom, dad, grandparents, any kind of a uncle, auntie, anyone, siblings. Unless and until you make them feel that, or you
Hmm.
regulate their sensory system first, the regulation of their sensory system happens, and then to the opposite person. Hmm?
Okay.
So
Okay.
water, they get all this kind of sensory information, and then we
Right.
structured format. Okay, यहाँ से चलो mug, हम we have a lot of toys in our aquatic therapy pool. It's a temperature controlled pool again, so warmth in the water, they are not kind of okay ये ठंडा है मुझे नहीं जाना है पानी में, तो ऐसा नहीं होता है कहीं पे भी. And there are a lot of toys over there. Okay, I want that fish, I want that bottle, or I want that mug, and then we
Hmm.
kind of a play activity. So if the child is taking a mug and a pouring water, so if he's looking at that water flow for a longer time, I can engage him his eye contact for at least few
Okay.
seconds. Okay, so
Hmm.
lot of techniques, and this is water specific therapy, what we call it. It's a structured functional goal we try to achieve in the pool.
Very nice.
Okay, yeah.
Thank you. Yeah, thank you. Interesting to know about this. So, can you tell us something about, how do you, like in your clinic, assess now different people, different children would have different needs.
Yeah.
Each one would have a different, problem with their sensory
Mhm.
perception.
Yeah.
So how do you evaluate the child? Like, how do you go? Can you just tell us a step by step? Because there are some parents here, there are some teachers on this
Uh,
call.
yeah.
So can you just describe how it's easy for them to also take
Mhm.
the action if they see something like this?
Right. Okay. So whenever any child walks in the clinic, so our assessment format always begin with history. So I think all medical doctors and all the medicos, we always begin with history. And in our history, we always try to mention the age of the parents. Okay, so age of the parents, working hours of the parents are very important, because in there are some evidences which shows that the stress hormone, which is related not only to the mother but with the father as well. And I will not stop there with the mother and father, but it's a genetically stress hormone is a carried over from our grandparents and grandparents also. Okay, so we always try to take that history, the working hours of the mother, or any stress, how you were during pregnancy, where you working, where you are traveling continuously, was there any kind of a trauma happened during your pregnancy. Okay, so it's kind of the stress hormone which actually uh, give them this kind of the stress to the child brain, and then when they come out of the womb, it's like their sensory systems are the one who are into the priorities. Okay, so everyone will not become a child with autism, but yeah, there are some things we always see them, so we don't call them completely autism spectrum as such. We call there are difficulties in a sensory processing. Okay, so like Miss Sheetal has said that हम respond to name. Okay, so मैं उनको बात कर रही हूँ, okay, whatever the name is, like ahan ahan ahan, so they, it's not that they are not able to hear, but yeah, it's a processing. They do take time. किसी ने आवाज दी है तो वो मेरे कानों में आने के बाद इधर से मुझे ब्रेन में कब जाती है. They might respond after few seconds. So the patient to have that waiting period, okay, मेरा बच्चा देखेगा, and there are ways to treat them also about it, how you call it, a name respond to the name. Yeah, that is just it. So that is another sensory processing disorder. So we figure it out after observation. How? So after history, then we go with our observation system. How, whether the child is has any kind of the seeking behavior, whether the child has any kind of a avoiding behavior. We have a sensory profile system. That's a proper assessment format. We go with how that child is getting regulated with any different kind of activity. So seeking, just let me give an example. He just keeps running in the clinic, continuously running. Just however you try to make him stop also, he will not. So we call them, he's a vestibular seeker. He just needs movement constantly. And if you ask him to just push my hand, will not be able to push. So we can say that there is a lack of a proprioceptive system, avoiding proprioceptive behavior, proprioceptive system. Okay, so these are the things, like we have that sensory profile. We do that during, and there is a formation called the SIPIT, which is a proper occupational therapy tool. So my occupational therapist, that happens at after the age of 7 years. So before that, we cannot diagnose our children as ASD. There is a scale called CARS, which is done by the developmental pediatrician under observation. So their developmental pediatrician can definitely diagnose your child as a mild, moderate, or the severe autism. But then there is a proper SIPIT format, which is done only by the occupational therapist after 7 years. That gives the exact diagnosis of ASD. Right, there are other psychological things also which is done by the psychologist. So then this again becomes a multidisciplinary approach. Your speech therapist also comes. So my child is lacking in speech, so speech, so let me give this is the reality why the speech they do not develop. If my child does not have a eye contact, how is going to look at my lips what I'm saying? So lots of kids listen to the music. Some kids or a maximum kids with autism like to listen music. They are very good in auditory. And that auditory processing, if they are continuously listening, they'll start humming the poems. Okay, Johnny Johnny, yes Papa, Twinkle Twinkle, they will know all the rhymes, but they will not be able to say what you are telling. Can you say mama, can you say mama? So this is not the way to mama, this is not the way to teach them. Unless you do not develop this will not happen. Okay, and as the sensory system, most of the children with ASD have the low tone in their body. So due to low tone, that's why they keep running, they walk on toes, their hands are like that, they will sit like this. Same way, your oromotor control is also important. So if they have a complete low tone on their body, definitely oral muscles are also weak. So some people do not like to brush their teeth at all. If they do not like to take any kind of a different food, they just want to have the specific food, maybe the smash food, which is very easy to just gulp it. Hmm? So yes, these are the things we always ask parent. Why speech is delayed? Is he eating everything properly? So these things in our assessment, we have those formats. We follow this, and as per that, then we assign them to the team. So occupational therapy work on this functional goal. That okay, then we develop our goals. As per that, however is the seeking avoiding behaviors, so I will always form a 3 months goal for my child. My child should be, if the complaints of the parents, we list down the complaints of the parents. The school going kids, we do list down the school complaints as well, whether he is hitting, whether he just running in the class, or whether he just kind of tapping, hitting, or maybe crying in the class. So all those things, why that behavior is there in the school, we'll try to try to like mention everything and work on the sensory systems accordingly. We'll have a goal like, okay, my child will sit in the place in one place for at least 5 minutes and do the ball catching and throwing activity. Okay, that will also is like, there I'm working on his posture, he's looking at the ball, he's coordinating with his hands and doing it. So if I achieve this, so then I know, so I will list down my goals accordingly. So but I will try to work on one goal. So then I will plan my occupational therapy intervention, my speech therapy, my aquatic therapy intervention as per my goal. And we always acknowledge if the patient is sent by developmental pediatrician, I'll always acknowledge my pediatrician that, okay, we have started with these many things. After 3 months follow up, let us know which things to be, and we take always guidance from them whether they want us to work on a particular things. That is it. And yeah, if they are into medication, so it's a completely their perspective whether the pediatrician is describing and if they are going to the psychiatrist or they are describing medicines. So this is how we plan our goals for the children with autism. Yeah.
Right. So, what do you feel is the best time or the best age when the child should be, appropriately diagnosed? Because sometimes the parents or the family doesn't understand it.
Mm-hmm.
The diagnosis is delayed. So, which age group do you feel is the best time for diagnosis?
Yeah, so here I'll just again take the name of Miss Sheetal. I am really glad that she said that she diagnosed her daughter at the age of 3 months. Okay, very smart parent. Very
Mm.
few parents are able to do that. Okay, very few parents can do that. So, like, why my child is looking only at one place? Okay, so yes, we can start observing changes at the age of the 3 months. From the two. So when my child gets the neck control also at the age of the 3 months. So slowly, but if it's too much of a wobbling, we can say that why he's not rolling or why he does not like to be on tummy for a longer time. So there are some sensory behaviors that already start showing. Sometimes they don't want hugging them. Okay, they just want avoiding contact. They will not look at the rattle. They will not try to reach the rattle or anything. So those three things, but very few parents miss these milestones. Okay, when they understand, oh, and in this the development is appropriate. No, it's like a physical development is appropriate. They start rolling, they start sitting, running, and most of the time they are early. So if 12 months or the 13 month is the standing walking time of the child, is a walking developmental milestone, they start running at the age of the 10, 30, 11. Okay, so very speed, so we can consider that they are hyperactive. Okay, if they are doing some milestone early also, that means they are just whatever using their muscles and they just want to be. So that is one thing. And speech, so at the age of 6, 7 months they start cooing, ba ba mama. Most of these children do not do that. And if you start recognizing these symptoms as early as possible, would be really good. And if one year old child starts walking on the toes, just get the checkup done. Why he's walking on the tone? Does he have a low tone? So there only we understand. So when they go to the doctor or maybe they come to any kind of the therapeutic center, we understand low tone. He might develop some sensory issues. Or he already have some sensory issues, and that's why they are doing it. This most of the parents come when they are a 2.5 years old or the 3 years old, when they are not speaking. And yeah, we have all kind of our community. हाँ, मेरा बेटा तो 3.5 साल का था तब बोला था. His father also talked, his mother also talked at particular age. So they are into that. So sometimes that's okay. But yeah, 3.5 years is too late for the speech. It's too delayed. So most of the parents come to us when their children are difficult, they show a difficulty in communication. And they are sent by most of the school teachers now. So I'm really glad that most of the school teachers are really trying to understand this kind of a behavior, sensory behaviors in the school, and they're referring them for the therapies. So as early as possible, if you really knows that 1.5 year of age, or even with the 3 months of the age. So see, basically autism spectrum disorder is there are the lack of, there is no integration between the sensory systems. So we start getting the all sensory system integrated as early as possible, your child will do best. Hmm? Yeah.
That's great. That's great. So thank you so much. One, I think just a few more questions, and that's like sometimes we see that because of the lack of awareness,
Yeah.
you know, parents end up doing. This was also mentioned by the psychiatrist in the first session. They
Hmm.
end up doing quite dangerous treatments, because
Hmm.
somebody's told them or something they've seen on social media. This has helped the child or whatever.
Hmm. Hmm. Hmm.
So I'm sure you may have had such experiences. So can you
Yeah.
just share so that our audience is aware and
Okay.
alert,
Yeah.
aware and alert. Yeah.
Yeah. So, see, first of all, parents with the children with autism always understand that this is not the curable thing. Okay, whatever things have happened in his white matter in the brain, that's going to be there for a longer time, and that's going to be the lifetime. जैसे आपको डायबिटीज एक पर्टिकुलर एज में रहता है, थायराइड आपको पर्टिकुलर एज में डेवलप हो जाता है, वो आपको पूरा लाइफ लॉन्ग रहता ही रहता है, right? You have to take medication to control that. Same way, autism spectrum disorder, it's a disease, it's not a curable. And then, like you take medications for other diseases, you have to take the therapies to just get rid of the symptoms. And I cannot say complete get rid, but reduce the symptoms and try to make them as independent as possible. इफ मेरा बच्चा इंडिपेंडेंट अगर मैं बोल भी रही हूँ, तो इंडिपेंडेंट अगर वो थोड़ा एक मुझे एक एक चीज एक जगह पे दूसरी जगह पे रखना है, भाग के भी रख रहा है, आई वुड बी हैप्पी. इट्स नॉट दैट आई विल एक्सपेक्ट हिम कि तू चल के स्लो चल, ऐसा ही मत चल वैसा ही मत चल, बट एटलीस्ट ही शुड बी इंडिपेंडेंट. ही शुड बी इंडिपेंडेंट इन हिज ऑल डेली एक्टिविटीज. सबका खुद करना चाहिए, ये टाइम पे उठना है, मुझे ब्रशिंग टाइम पे करना है. All these things are very very important, and therapies are the only thing which is going to help your child throughout the life. And when I say therapy, so see, in the beginning, intensive therapies would definitely help you, like occupational therapy, aquatic, and the speech, and if needed, the behavioral counseling through the psychologist. Definitely that has to be. Once it start growing, his needs will change. He might stop all the therapies, or maybe do a therapies in a less frequent manner, but then he will be doing more of the remedial education where his education would be taken care of. And then in that case, education. So I know people, as in पता नहीं आप लोगों ने good doctor करके एक series है. If you anybody has done that, that Sean Murphy is the doctor with autism, and you know that how he really manages everything. He tried to get adjusted with all kind of environment, and there were some incidences where he really do not get adjusted, but then he is become they are extremely intelligent children. If you just have that one kind of thing, if you know that ये निकालना है एंड मुझे बस मेरे बच्चे के लिए उसी के लिए ही काम करना है, यू हैव टू कीप दैट. सो लाइक टिपिकल किड्स, वी ऑलवेज पुश देम, ये करो वो करो, बैडमिंटन क्लास है, फुटबॉल क्लास है, सिंगिंग करना है, वो करना है. हम इतना सब करते हैं, फाइनली किसी में एक में ही बच्चा ये हो जाता है ना एकेडमिक, आज इसको इंजीनियर बनाना, बट नाउ तो अभी कुछ भी नहीं होता, बच्चों को जो करना है वो कर लेते हैं. तो व्हाई वी डू नॉट गिव दिस काइंड ऑफ एटमॉस्फेयर टू children with autism? And there are a lot of things the government is doing for them now, right? So then always remember, do not go for all kind of a therapies like a stem cells. अभी आप सब सोशल मीडिया इतना ज्यादा ओवर पावर है, सब जगह पे कोई भी लिंक इधर से भी कोई भेज देता है people. And yeah, I can understand the parents perspective, we really want to give 100% to our child, but before going for any kind of a new things or any kind of a trap, just do the evidence research. Do the evidence research and see to it कितना हुआ है, कितना ठीक हुआ है, क्यों हुआ है, और जिन लोगों ने उसमें पैसा भी डाला है, please talk to those parents and then go for all these kind of therapies before just किसी के लिए just ये बोला है करना है, ऐसा करना है, वैसा नहीं करना है. And if I say a stem cell, let me give an example. So I had one parent who used to come to my, so this child is with child with autism, so he used to come to me when he was 2 years old, so very early detection has happened. We were trying, and we are trying to, so they're not much educated parents though, they were trying, and they just left my center during COVID time, and then they came back after COVID, after a year or so. And then I realized they had done this stem cell therapy. And then she came to me, and then she was and then she told me, ma'am, मी असं सगळं केलं आहे, हे असं असं झालंय. मी म्हटलं मग काय फरक पडला तुला त्याच्यामध्ये? व्हाट डिड यू, क्या क्या तेरे बच्चे ने ज्यादा सीख लिया जो हम लोग इधर नहीं करवाते थे, और आपके बच्चे में जितना इम्प्रूवमेंट है, तो आप मेरे पास आए हो, दैट मीन्स अगेन you had that trust on me, you came back to me because you tried something else. And then, she used to carry that stem cell ka file and bag every day in my clinic, and anybody from my clinic has asked her, आपने ये किया है ना, तो ये कैसा था, कितना फर्क है? So she used to say that मैं ये जानबूझ के बैग कैरी करती हूँ कि ये मत करो, मैंने मेरा पूरा इन्वेस्टमेंट इसमें डाल दिया है, मेरे बच्चे को 1% का भी फर्क नहीं है. Okay, so I used to really happy that she used to carry. So that kind of awareness she used to like, that was really good. I did not say that usually people carry bags and all for the positive awareness or the positive publicity, positive marketing. She was doing it for the negative marketing. Okay, so that was one thing I
Very
really
nice.
about her. Yeah.
Yeah, yeah. So
Okay.
good, so good. I mean, it's so good that, even though you've made a mistake, you're not covering it up, but you're
Yeah.
telling people don't do the same mistake. So
Right.
that's very
Yeah.
good. Yeah.
Yeah.
So that's why I wanted to share this, ask you to share this, because there are so many things going around, so many new therapies, new forms of, but we need to, like you said, evidence-based medicine is what we would recommend everybody to
Yeah.
go for and see whether it's truly effective or whether it's just some hype that people are,
Yeah.
following. Can you also give us some success stories, like, something that you've really seen people living, like you said, this person has come when he was 2 years old.
Hmm.
Now,
Yeah.
after so many years, how is a person day-to-day life? How is he or she managing his day-to-day life?
Right. Yeah. So I do have lots of success story. I'll just give one of the child with a severe autism, who used to come to me when I had my clinic in Vajira Naka. That time I did not have my aquatic therapy set up and all. So this one child had tried a lot many therapies everywhere, and then she somehow visited me that okay, she's a severe autism. She used to just have do the 10 minutes of therapy. Lot of issues she had it, and she had a cerebral palsy also along with autism. But her autism, with the autism symptom was in the higher verge than the cerebral palsy. So we are treating both ways to her. So she used to have just 10 minutes of therapy, that also mobile over here. Okay, constant mobile over here, and then do that. So she continued with us. She trusted us completely. We really got her regulated in all her sensory system. She's an independent walker now. She was a hemiplegic on one side, but now she's independent walker. Walker, and yeah, she's a non-verbal child with autism. Parents were educated. Yeah, so they made it a point that whatever they are giving to the child, it would be a complete 100%. Mom has started doing tablet activities where she was not a non-verbal child and not able to communicate at all. So we used to do a speech therapy, but we understood that she is going to be the non-verbal child with autism. So we tried to the other things that where we can make her communicate. So see, communication is the one the child gets really irritated if the needs are not been done. Even we feel that way. Okay, if we are not able to, the stress, it just gets accumulated in our body, and the responses are like anger, anxiety, impulsivity. Okay, so that is what happens with the children with autism. So the movement we've started with the tablet, she was already going to the special school, and the learning alphabets and everything was happening pretty well, and we taught us how to communicate on the tablet. So whenever the therapies used to happen, and any of the time if there is a change of a therapist happens with her, she used to go and tell her mom on the tablet, I want only Dipti Didi for the therapy. I do not want anybody else. Okay, so that was one thing. The mom used to call me, ma'am, तिने आज मला असं सांगितलं आहे. So make sure that you are available for the therapy. Okay, so these are the ones. So now she's now 17-year-old child. So she used to come when she was like 4 years or something from that point of way. So she is doing all her education through the tablet. Okay, so it's like yeah, so we have like helped her everything. We The communication with parents are helping her excellently with her education system also. And I would like to give examples, as I given the Sean Murphy's example. There is a Temple Grandin. It's a very famous personality with the autism spectrum disorder. She's a very good speaker. She speaks in the on the conferences and everywhere, but there is a any kind of a questions has been asked her in between, she will break her flow, and she will stop there, she'll just stunt over there. Okay, so you can really build these children with their whatever qualities and just understand them. Hmm? That was one example. And another one, there is a child, he's also the severe autism spectrum disorder. He was in a Saudi Arabia, so I used to go for my lectures to Saudi Arabia also. So somehow they got my references, and they shifted, they're basically Indians, and then they shifted to Mumbai and then started aquatic therapy with me. That child has a severe sensory this thing. He will just keep running, he'll just keep doing all these stereotypical behavior used to constantly have it. And auditory, any of the sound, was it too much of the auditory avoider child, so any of the hard sound, or if any child also crying in the pool, and if I am taking his therapy, would be completely disturbed. But in the aquatic therapy setup, he used to be so you know what happens when you go underwater, you cannot hear anything. Okay, yeah. You cannot hear anything, so he has got that habit. So if any child crying in the pool also, if I'm taking 2 3 patients at a time, not me but the other therapist also, and I'm treating him, he used to go underwater because he was avoiding that. So see, so how to regulate his body by using the other sensory systems in the pool. So that was one thing. And like after doing 3 months of a consecutive aquatic therapy and OT sessions also at our center, that child is completely regulated. Now they have shifted to Dubai, because she's like, now my child can take admission in the school, or maybe it would be the special school. And yes, speech was, he's again, as I said, the children with severe autism have a little verbal issues, so he's also a non-verbal child. But communication with like a kind of a gesture, he was doing perfectly fine and completely regulated. He's become completely regulated child. Yeah.
Thank you. These are so heartening to hear. I mean, it's so wonderful. Like, no. Now, one last question. I think you've already covered it, but something you can tell us practically.
So
And then after that,
your
can you hear?
voice is your voice is breaking
Is
in
it better now? Is it
Yeah,
better
now
now?
this is
Okay,
fine.
okay.
Yeah.
So this is the last question, and then there will be, I'll open it up for the audience to ask you questions. What can we do as families? Like, maybe in the communities, what is something practically that we can do for people who are having children with autism? How can we support? Like maybe we don't have in our own families, but how can the community help? Is there some advice that you'd like to give us?
So
What?
So as a family, I think we should understand our child. Like see, अगर हम लोग हमारा we if we understand. So I know, because I'm the Masi of my my neurodiverse child, so I understand what pressure we do have it. क्यों मेरा बच्चा ऐसा नहीं कर रहा है? क्यों मेरे बच्चे को 90% नहीं मिल सकते हैं जो बाकी दूसरे बच्चे को मिल सकते हैं? But I think these kids are the special in their own ways. They can do everything, they just do everything differently. So always understand that perspective. They will do everything, they will always make you proud. So always keep that in mind. So family, as an immediate family, should always think that way. And yeah, the communities, like Dr. Shweta also has discussed few things about it. Like government is really helping these children. Now now I read just 2 3 days back in Times of India. So they have developed autistic Barbie. Okay, yeah, so that was really good thing. So if the doll, if the normal doll, if that or child with autism is not able to play with hair or anything, maybe this autistic, I haven't seen the toy how it is and all, but I just read about the other day. I was really impressed. So the people are really thinking. And you know why? Because this neurodiverse kids population is increasing day by day. Okay, so there are lots of people, like every 10 to 12, and I have as in there were some statistics has been shown earlier that by 2020 80% of the population will born with the children with autism. Okay, yeah, and that's happening. So yes, and this is like our lifestyle basically. Okay, so yeah, so anyway we have to, so the government is really helping. So UDID card is really necessary for this. You get extra concessions for that. You go for the regular IQ testing, not regular, but once you go to the government hospital like in Mumbai, Nair and JJ, they give you the certificate. Then you apply for the UDID card, and then you have a, and if it is not Nair and JJ, RCR certified psychologist, you can just have the proper assessment done for your child, and then have the government card and submit to the school. So you get extra help, whether you get a writer, you get extra time. If your child is good in everything, you get extra time for that. So all these helps government is really doing. And do not think that way that my child will not be educated. He will be educated in a different manner. So there are boards like Pratham, not like our CBSE SSC. There is a Pratham board, there is a NIOS board. So these boards have the particular syllabus which is done only for neurodiverse children. Okay, I
Very
hope that,
nice.
yeah.
Thank you so much. Thank you. This is very helpful. I think now it is time. We just have 15 minutes more, but I'd like to open it out for the audience to like unmute and just ask their questions.
Sure.
And yeah, please go ahead, those who I'll remove the spotlight right now. So please feel free to either put it in the chat box. I think one person has already asked, Ajit has asked for consultancy directly. Definitely, we can connect you to Dr. Dipti. Anyone else would like to ask any questions? Anything that you all didn't understand or want further clarity? I think you've
Um,
taken an excellent. Yeah, yeah. Go ahead. Go ahead. Sorry.
yeah. So I wanted to ask about ADHD with
Uh-huh.
autism. Like, how do you deal with that
Yeah.
and identify? Mm.
Yeah. So there are kids with ADHD and the autism spectrum disorder. So that becomes really sometimes difficult because ADHD children are very very hyperactive. They will not sit in one place, and they are continuously doing something or the other, which is sometimes really difficult for the parents to understand them. As I mentioned, that these therapies really help them. So depends on again again the symptoms where they are, where they are extremely high doing that. So how you resolve those symptoms. And there are behavioral patterns. Okay, if your child is continuously clapping or continuously going to the lift and just pressing the button of the lift and just see how that movement happens. Okay, so in that case there are a proper structured format what we tell them. So we allow child sometimes to go to the lift like 10 to 12 times in a day. So that sensory system, we really have to get that child's into their physiological system and understand, okay, this movement is enough for you now. Okay, you do not have to go to the lift again. So sometimes such kind of a behaviors, and these are the sensory behaviors which we have to tackle as per their symptoms.
And would you like give them medication?
Oh yeah, yes. Sometimes it's really so. When we send them to the developmental pediatrician, then she also makes sure that they are taking some medication. So Risdon and all, I will always help them. So medications with the severe ADHD with ASD kids help, and the therapies are always complement them.
Wow, okay, thank you so much.
Yeah. And do not consider these are the sleep medicines. Okay, so this is like they do the calming of your brain. So ADHD kid will not be able to sleep also throughout the night. Okay, so I'll just give you one thing what you can, not kind of an intervention, but just one suggestion. Always try to keep the heavy blanket on them at night. Whether the weighted blanket or the heavy blanket, or if like we get those kolhapuri chadar, which is like those are a heavier one, but those will not kind of harm child, or maybe इसका texture मुझे पसंद नहीं है, ऐसा होता नहीं है. तो kind of those kind of 2-3 चादर also आप अगर उसके ऊपर डालते हो, he will have a better sleep at night, because lots of the kids with ASD and ADHD basically, they are not able to sleep at night, and the next day the irritability, impulsivity, hitting behavior and running throughout is always there. So try to see to it how you make your child sleep peacefully at night.
Thank you. I think this importance of medication along with therapy, I think all of us need to understand this, those of us who are joined on the call, that medication is not something that we should run away from,
Yeah.
because it's complementary.
Yeah.
It complements your other therapies, whether it is your psychotherapy or your physio or OT, occupational therapy, whatever it may be, depending on the need of the person, whether it is a child or an adult or whatever your treatment you all are taking, it has to be a holistic approach.
Yeah,
So please don't shy away from taking medication if the doctor feels you need a medication. And then, of course, once you start the therapy and the symptoms are reduced, then you can slowly taper. It's not like you need to take it lifelong. It may not be necessary that you have to take it lifelong. So,
Very,
yeah.
As per the age and as per the symptoms reduces, it tapers down.
Can be tapered. Yeah, can be tapered. Sometimes we go unnecessarily, we prolong the whole therapy. Medications are available. I mean, God has given us medication for a reason. So we must use medications. We can use it wisely if there are symptoms because of the medication, because some medications do cause side effects.
Right.
But they can be changed and made into other medications, because right now, research has given us multiple options.
Yeah. And one more thing I want to say over here, and whenever doctor prescribes medication, please do not Google them. Okay, because Google will give you the 100 side effects of it and you do not start it. That there is a complete different information which you get it in a Google. See, doctor has prescribed you with some reason, so then always try to trust doctor for the medications. And unnecessary, I know there are a lot of a good pediatrician who will never give the medications if it is not required for the child. So so please follow that.
And don't stop the medicines without
Yes.
consulting. That also causes a rebound effect.
Yes.
Because these medications take time to have its effect. It slowly starts, it at least takes a minimum of 2 weeks, especially psychiatric and medications for the mind. So you wait for 2 weeks, and still if you don't find relief, then you go back to the doctor and the doctor will adjust the dose.
Right. True.
Yeah, Liti, you can unmute you.
Yeah, thank you. So I just want to understand, like, this ADD, is it very different from ADHD, or what is,
Okay. So see, ADHD is a attention deficit hyperactivity disorder. ADD is only attention deficit disorder. Okay, so your child will not have a much of the attention, but why that attention is less, so that we need to kind of evaluate or do the proper assessment for that.
Okay, so he was diagnosed recently, means just a week back, about ADD, but I didn't know anything further can be done with it, because I was only told that he can be given, he has to take a break after every half an hour. That is only I was told. So is there anything else that I can look for?
Yeah, so see why they have assessed. So there are a proper assessments, a mechanism like DSM-5 and all. There are, so according to that, we diagnose whether it is ADHD, whether it is ASD or the ADD. Okay, so 2 hours break, it's not that way. Maybe this is like a kind of the vague statement every two hours. So is the child really attentive after coming after also 10-20 minutes of a break?
No, what he was, the reason I took him for the assessment is because he said, Mama, I'm not able to focus in the class. When teacher says something, I'm not able to make notes with that, and I'm not able to understand anything. So he used to avoid going to school, and I used to not understand the reason of his avoidance, correct? So recently, when he told me that I'm not able to understand or focus, then I thought there is some, learning disabilities there. That's the reason I took him. So, but the counselor, what they told me is that you have to take a break after every half an hour. That is only I've told. Now I've been told. So what extra I can do to
Ye-
help him out is
Right.
another.
Yeah, I think you should do a proper. So that assessment is fine. That's the assessment done by a psychologist. So when you come to us or maybe the occupational therapist, they will see why his attention is not proper. Okay, whether his body or the posture or if the other things also are in a proper place, why he's not able to focus on how is his IQ. As in, have you done his IQ also?
Yes, his IQ is 117, they said. And but when I told him 117,
Hmm.
he's very this thing. He's saying no. They should have told me earlier that they are doing my IQ test. I would have been better concentrated. My IQ is better than this. He's telling me. So
Uh,
he knows
yeah,
he
exactly.
so he is feeling he should do his IQ again. That's what he's been
Okay,
telling.
so fine. See, if the child is coming and telling you, Mama, I am not able to focus, I'm not having attention, that only says that he must be having a really higher IQ. Okay, because anybody will not be and is already interested also in his studies because he's not able to give that 100%, and that's why he came and just spoke to you about it. So we need to really figure it out why this attention span is less, why he is like diagnosed for the ADD, or we need to check about it. And then see, giving just a break after 2 hours, I don't think so he'd focus will be. We need to find out the cause why the focus is less.
Yeah, because I have noticed it from childhood that
Hmm.
talking on the mobile
Hmm.
on video call, he can't sit straight. He will just be moving.
Exactly. Okay.
So no, it's difficult for us to talk. Like if I'm standing and talking to him, he will go around me
Yeah.
talking. So I have to go round and talk to him.
uh,
So movement issues I have seen like.
Right, right. Okay, so that's the reason. Then he's not. He must be all the time fidgety also in the school, and he will.
Yes.
Yeah. So fidget. So that also causes the lack of attention in any kind of activity. So
Hmm.
need to do a proper assessment to check. So the movement system is already a lot in him, and that
Yes.
then here we do not go in that appropriate manner. So how we can inculcate that movement system to improve his focus? We need to work on that.
Okay. So for that I can connect with you or
Yeah, you can. So we have our setup in Ashok Hospital and the Ashok one also. You can
okay.
appointment over there. We can have a word and we can have a proper assessment over there as well. Hmm?
Okay. Thank you so much.
Yeah.
Thank you so much. Those are great questions. I think we have a comment from Sangeeta. Sangeeta is also part of my team. She's helping with the Rahat work.
Mm-hmm.
So just want to give you all a brief about what Rahat is about. And Dr. Dipti is joined not just the Rahat team, but the entire Ashok and Ashokman team. So we have right now formed a small little, a team of mental health experts. Our aim is to give whole person care. So we're just not looking at neither just physical, neither just mental health but we want to look at the holistic background of whatever person comes with. So they may come with many different symptoms and signs, but we just don't want to look at it, oh, this is a mental health disorder or this is a physical disorder, but we want to look at it in a holistic manner, to look at the mind, body, soul, and spirit within the context of the family and within the context of the community, because that affects the person. So that's how Rahat is formed, and we have some of our team members who are already here. Dr. Dipti, thank you so much for today's session. And if Sangeeta, if you can also unmute yourself or just put your screen on so that we can spotlight you also. Can you just, you had something to add?
Hi, good morning. Good morning, everyone. I was here at this session, and the session was so insightful. So thank you, Dr. Dipti. And see, I am also a clinical psychologist, and with the RCI, I'm studying and like I got through for my RCI license. And so even I'm also dealing with different kind of mental health disorders and children as well with the ASD, autism, ADHD, and mental retardation and intellectual disability also. So I see in that in a group, I see there are few old people whom I know who are working in the community extensively. I know. So for them, I would like to add one information that. So there are many children because I think the question came up from Vinita ji, what can we do as a community? Maybe we are not having a children But we are a part of a community where we do see a lot of children and parents who might be struggling with this kind of problems. So the anybody in this mm, group who is working extensively as a social worker or as a service provider in the community level. So with the children who are 0 to 6 years, you all can ask the parents in the community to get in touch with the Anganwadi. So in the Anganwadi, they have a screening done. Basic screening is done, which is done under RBSK. That is Rashtriya Bal Suraksha. Um Over there, they do an assessment, they do an early identification. So any child who has a symptoms for autism or a ADHD, then they from there they call the parents, they recommend them and ask them to go to the government hospital, like how Dr. Dipti already said, some of the government hospitals in Mumbai. So if you're not from Mumbai, but in every district and every state, there are government hospitals. So they will recommend you to go to the government hospital. And over there, you will have a clinical psychologist with the RCI license who will do your assessment. So for the certification, it's very important that the license, that your assessment is done by the RCI clinical psychologist. You should always remember that. Once they give you proper assessment, they will write it down. They will tell you what is exactly the severity of the child. There might be mild, they may be severe, they may be moderate. And accordingly, they will, that signature, that assessment report, they will ask you to go to the disability department, which is in the government or department. You will find it in disability sector. In every district there are there. And over there, they will give you a certificate with mentioning what is the status of the child as per the assessment. And that certificate is very important for the child because the, because we know that the education system that we are having, we are not having so many special educated institution, we are not having around. So we are helpless at times, and we start with normal school who might not having all the infrastructures for the neurodiverse children who are suffering with neurodiverse. So, but that certificate do help to, there are many schools who says you are not allowed in a school, we cannot deal with it. And sometimes teachers are not also aware what is happening with the child. So this certificate also helps the administration of the schools to help them out for to have that particular right, so that you can tell that my child is eligible for that particular education. So as a community worker, you can always ask the parents to go to the nearest Anganwadi worker, because early identification is very important for any ADHD or ADHD children, and get a proper certificate and ensure that it is done by the clinical psychologist, and with the government hospital you get the certificate, because without that it is very difficult. And why I felt this information important, because I see there are many participants who are extensively working with the community.
True.
So this
True.
information can help you out. Okay. So
Thank
thank you
you.
so much.
Thank you so much, Sangeeta. Yeah. So it was really good to have all of you all join us. Thank you, Dipti, Dr. Dipti, and all the others who have contributed towards this. And I hope that we'll keep connecting and engaging, bringing about awareness in our communities. Yeah,
Yeah.
so thank you. And you can keep, I put my number on the chat box. If you all want to connect with me, you can connect with me.
Yeah. Okay. Thank you. Thank you, Dr. Vinita, for having me.
Thanks. Yeah. Thank you. Bye.